in the United States, over 14 million or 25% of people over the age of 65 will fall each year. Now, to be clear, that's people who report it. So we believe that that number is significantly higher. This risk goes up quite non-linearly. So by the time we're talking about octogenarians and nonagenarians, the annual incidence of falling is at least 50%. And you'll recall that I said that the risk of death from that fall, depending on the series you look at, will be somewhere between 15 and 30% of those falls, if they result in a broken hip, will result in fatality within the 12 months that ensue.
Now, some of these data here, they're from Ottawa, and you can see that one of the causes of going to nursing home is actually falls. A lot of people who fall, that is a transition to long-term care or retirement homes or nursing homes. So that's kind of important to consider. The other thing is, how do you actually prevent it? We have some tips here. The tips can be, this is not an exhaustive list. There's many reasons for falls, but these are some of the common ones. One is decluttering your environment. This is huge. And somebody who has worked in a retirement home last year for 5 months, I realized, I saw this firsthand. In fact, the number one reason for us calling the ambulance was falls. Now, most of the time, people were not injured, but it was extremely, extremely common. And the most common reason, it was not a sole cause, it was actually multifactorial, but decluttering spaces was one of the biggest ones. And wrong shoes, wrong sandals was another one. Eyesight is another one. Not being complacent on that and making sure that's checked if it can be helped. Medications, some medications, having your blood pressure too low. These are all things to discuss with your doctor. Very important. Being in a well-lit environment, having guardrails if you can. Even having some backups. You can, like anybody can fall, so just having backups in around the house. If you ever do fall, you can catch yourself. Now, part of that is some of the balance training we're going to talk about, but having, being close to a chair, being close to a bed, just to grab onto something, that's also very important. In the shower, a lot of people fall in the shower. That's also important. Having non-slip rubber mats and just doing things mindfully is probably my biggest tip. Not doing things, not rushing to go places. It's kind of like driving too quickly. So don't walk too quickly. Don't get up too fast. Those are very important, because even if you do all these things, or you can still fall if you're not careful. And that's when people are just not paying attention. They just kind of feel okay, and the fall happens. Again, that's not everybody, but it's definitely some people. Now, it's getting activity is important. Balance training, Dr. Curnew, I'm sure you have favorites out of these examples. My favorite is probably the step down, so-called eccentric exercises. That is when the muscle is lengthening. Eccentric, concentric is when you contract. The reason step downs are my favorite is because a lot of times when people fall, it's the inability to catch yourself with your feet. And you can exercise that with the step downs, for example. Now, that's what we have here is a side step. You can also do it going down the stairs, hold on to the stairs and go and do that. Do it with weights. So we can see on the left, she's doing a step up. You go up and you go down with weights. So you get both worlds. You get a step up and you get a step down, right? And then we have the leg strengthening. That can be a little bit difficult for most people. This one at the top left right here, that gentleman doing a single leg standing exercise. Now, I do that for strengthening myself with weights, but it strengthens the legs. You can also see this one on the right. Let's say putting your socks on. That's something you can do. Actually try to do that. I do this for warm up as well. But again, you can do it. It's very easy to do these things. Just making a habit of yourself. Whenever you're putting clothing on, practicing it, right? Just mindfully practicing it. And even when you're at risk of a fall, just mindfully moving. That's really important. Sit to stand is another one. So you can see some of them is leg strengthening, but it's also that neuromuscular connection. Having the habit of using those muscles that stop you. You can put the brakes on. Dr. Kern, do you have any favorites of these things that you try? Do you recommend that you've seen people trying?
Well, one of the things that I was doing quite a bit of before is that when I put my socks on in the morning, I lift up one foot and try to put my socks on while standing. And I find as I have a wet foot with tight socks, it's more challenging after I come out of the shower. But I go through phases about this. But I notice that my ability to keep balance is dramatically different, and left or right footed or whatever, you find one leg's better than the other. So I think this is something that's a key issue. What I will tell people to do is when you get up slowly, sit at the side of the bed for a little bit, especially at nighttime. You come from a warm bed. Most people turn their heat down at nighttime, and then just sit there for a second and then get up and make sure there's a light on there. And I think that's important. And you got to know your blood pressure. It's, we're trying to keep your blood pressure down, but if we keep it too low, we do more harm than good. And we're always balancing that effect. So lower the blood pressure, the longer you live, the lower your blood pressure, the more you fall. And it's very clear in Ontario, when someone starts you on a blood pressure medication, you're more likely to break a hip in the first 6 months. I'll repeat that. Controlling blood pressure, getting a blood pressure pill, will increase your risk of a hip fracture in the first 6 months. It doesn't mean we can't lower your blood pressure. It just means we have to decide how dizzy you are. And I asked, we have this question called postural dizziness. When you get up, you get dizzy, that hot tub effect. And I have no idea why most people, when you hear the age of 65, you see numbers between 25 to 50% of people over the age of 80 years of age will fall. And if you don't know your blood pressure, you can't really manage it well. So I love these exercises, do different ones. There's two types of falls. There's a young people's fall. You fall and break your wrist because you catch yourself. Then the old farts fall, like myself, we can't catch ourselves and we break our hip. And you heard mortality data from anywhere between 10 and 50% of people who fall and break their hip will pass away in the next year. 50% of people who break their hip will never gain full mobility again. So that's a lot. So this fall prevention is really, really important. And building muscle is important, and balance is important. So these are actually very key factors in all of this.
Yeah, thanks for sharing that. And just to give a shout out, I know we're in December now, but November is Fall Prevention Month. And there's a website if you want to look it up. It's called Falls Prevention Month. And they have a lot of really good resources regarding how to prevent falls that kind of go a little bit more into depth. We also have a past webinar about fall prevention that you can also check out if you are interested in learning a little bit more about this information. Yeah,
Thanks for
that's the
sharing this,
website.
Haley. Yeah, I'm going to take a look.
It's super helpful. There's even some like games and stuff like if you want to have a little bit of fun while doing it in crosswords and stuff, it's a really good resource.
Just practice just standing on one foot. You have to, you're at the kitchen table, you're cooking dinner, stand on one foot.
And one more in back, as I was going to mention this, I forgot. I put on the top left, if you do any of these things, I've noticed that some people, when I mention these things to them, there's this fear of falling or not doing it correctly. So just do it with a chair. Have a chair around. You have that psychological and tangible support in case you do feel lightheaded, in case you want to sit down, etc. You don't have to do it like these figures right here. These are just examples.